The relationship between stress and infertility has been debated for years. Women with infertility report elevated levels of anxiety and depression, so it is clear that infertility causes stress. What is less clear, however, is whether or not stress causes infertility. Power couple Mandy and Tony Rodrigues share their expertise on how to deal with stress and infertility. This is How We Cope. I'm Hugo Ribatica. The coronavirus, COVID-19, has brought about many challenges. Topmost is stress, all sorts of stress for couples and individuals across the globe. Today we have in studio Mandy and Dr. Tony Rodrigues. Thank you so much for speaking to us.
Thank you very much, Hugo.
So before we start talking about stress, we want to talk a little bit about infertility. Now, Mandy, you have some experience in that area. Please take us a little through your journey.
So I tried to have kids in my 20s and I suffered a miscarriage. And then at the time, the two of us were in a business together, and knowing he's the top fertility specialist, I decided to go and see him. Went through 2 in vitros that were unsuccessful. And then how you always know, you hear these stories that suddenly after you kind of give up, you fall pregnant. But I lost that one too. They were both early miscarriages. Did another IVF that didn't work. And then fortunately, with some supportive therapy after that, went on to have my own children, which was incredible. So that's how I got into the field of loss and infertility.
At what point in your life? You obviously tried in your 20s. Was this in your 30s?
So it took me, my previous husband was much older than me, and I knew I had problems like endometriosis. So instead of waiting, I decided, let's go for the most invasive procedure that we could, and due to the miscarriage. And then it was about 2 years later that I finally fell pregnant with my first daughter that I managed to carry through.
What about the emotions that you would have gone through? Obviously, IVF as an option means that you've walked a journey already where you failed. Was this part difficult? Did you doubt that you would have kids at some point?
I did. I kind of, there was no support groups around then. I would hide away and Google and look at bulletin boards, and that's how I'd get my support. I found it financially challenging at the time, but very much emotionally challenging, because people around me didn't know the whole scientific aspect. They didn't know what was going on, and this was 25 years ago. There was still the stigma attached, and it wasn't out there in the open with family and friends. So very isolating at the time.
So you had 2 successful IVFs?
No, none of my IVFs worked.
Oh, wow.
So it gave me peace of mind that I could produce embryos. But at the end of the day, it was every time I had a longer term plan and was looking at when can I do my next one, and that was my goal, I would fall pregnant in between and then need support in terms of progesterone, etc., to maintain that pregnancy.
But you've now successfully had kids?
Successfully had, yes.
How many have you had?
I've had 2 older ones, and then we share a little one, Matthew, who's 13.
Fabulous.
Yeah.
Now, Tony, you're a fertility specialist. What are the causes of infertility?
Right,
or the major causes?
Yeah, so we break it normally up into 2 groups. You get there is a bit of a discrepancy in people in a low socioeconomic group. They tend to have much higher incidence of infective disease, so that'll cause problems with the tubes, and on the male side can also cause infection in the testes. So that's very big amongst worldwide, across all races. It's actually there is no difference actually between race and infertility. Social class and money, yes, that plays a role. So that's one big group. In our private practice, we don't see a lot of that in terms of the tubal disease. And then you get what we call lifestyle diseases, which are the 2 big ones are a syndrome called polycystic ovaries where women don't ovulate properly. They have problems with their hormones. And then linked to that, there's this big disease called endometriosis, big in terms of a lot of our patients, 90% of the women we see have endometriosis.
You describe it as a lifestyle disease?
Yeah, and we feel strongly about it. You know, we wrote a book 21 years ago called Faster, Better, Sicker. We described a specific type of personality called time urgency perfectionism. And we found that group of people are very highly stressed, and the stress changes the immune system and allows things like endometriosis, which is a growth of endometrial tissue or lining of the uterus in the abdomen. It actually starts that up and grows in the wrong place. So that's the big group we see. And obviously we're seeing women having their babies much older. That's another group. So that's a problem, where women are supposed to have their babies at a younger age, but that's getting older and older. And with that comes poor egg quality and reduced fertility.
So what is the ideal sort of time for a woman to have kids?
Look, I think in an ideal world where women are supported in the world of work, where they're not discriminated against when they leave because they're pregnant, and they're allowed to go through those milestones. The ideal age is in their early 20s, actually, from a fertility point of view. But you need a lot of motivation to allow businesses to incorporate that thought process. So if I left as a lawyer or whatever, when I come back, I'm in the same position, I've got support systems, then people would have it at a younger age. So younger, better, but obviously in the real world, you need to earn money, you need to buy a house, you need to create a world for yourself before you have kids. And obviously now we're talking women in their late 30s, and a lot of women are not having partners, so they're having to go on that journey on their own. That's becoming very, very common as well.
Mandy, earlier we talked a little bit about the support structures that you've created. Will you take us through that?
Yes, so originally we started with time urgency, perfectionism, stress management groups, which was ultimately at the very beginning women battling to cope with infertility and reducing their stress in the hope of a better outcome. So we started with that, and then it grew to in the last couple of years to include loss and infertility, and groups like Empty Wombs and groups like House of Fertility, IFASA, a non-government organization, HANA, and I kind of help out with lectures there and help out with those support groups. IVF Media, which is a huge support group that's kind of worldwide and international, adjusted during COVID. So yes, there is a lot of support now.
And what's the substance of the lectures or the information that you give out, or the support that you give to these women, presumably?
So a lot of it would be normalizing what they're going through, and a big thing is trying to destigmatize what they're going through. And then the impact it has on the marriage, the impact it has on creating depression, post-traumatic stress disorder, and then with the loss in terms of how to cope with that. And then a big portion in terms of managing stress, because not only for falling pregnant, but going beyond. You want to be a dad or a mom that's healthy when you're 50, and you're living there to see what you've been struggling for. So something we look at even after moms and dads have given birth.
One of the things that we talked about offline was the levels of stress between couples, that the greater burden seems to fall on the woman. Tony, do you find that that is correct, that men are not as stressed about infertility, or in the case where a woman loses a child? Or
I actually find that the group of men that we see in our practice are on board. They come to every visit together during that fertility journey. And again, it's not every guy, but the guys come and they're with their wives. I find they do take strain. I really do. And they have shared, they go to a shared appointment with Mandy. It's not separate. You know, men have to realize that they're allowed to feel sad, and they're allowed to go through a journey. And I think we're seeing that. I encourage the men to go and speak to Mandy as well, together with their wife. It's hard for them as well. You know, they get mocked when they're around people, whether it's cultural or whether they're friends, and they're saying, "Where are your kids? You know, you're just thinking of money. You don't want to have a kid." And yet they're going through this journey. And I've got women who are moaned at from a family point of view, saying, "When are you going to have this baby? Please have this baby." And it's got nothing to do with it. The guy has this major sperm factor problem. But I think that journey should be sold, that it's a team effort. And if we sell that through discussion like this, that guys and girls could get together, share it, be together, and hopefully come out the end without leaving each other, because that's a big part of that journey.
Many of these support groups, are they specifically for women, or is it a combination?
No, so the stress management, definitely combination. In terms of seeing women and men, in terms of making what is the next decision we do, what is the next decision, definitely couples. I mean, I that's what I really hope for. Empty Wombs, Hope Box initiative that deal with loss. We're finding an incredible amount of the women are bringing their husbands along, and in fact extended family members. So it's no longer just limited to the women, but it's a slow process that we're trying to get through, because they do grieve differently and they do make decisions differently. And I see the men are more kind of worried about their wives and how's their wives coping, and they suppress a lot of their sadness, and they don't speak to their friends, and they don't want to speak to their wife because it just distresses her. So they carry this in, worry about their wives, and then at a later stage, it emerges.
And the creation of a separate support group for men specifically, by men?
I think that's a very good idea. I would hesitate to say I don't know how many men I know would be willing to join that. That's how big the stigma is. So when they're coming to see me, they're often initially dragged by their wives, and they sit with me together, but then once they get to know me, they'll come by themselves. Ideally, yes, we would like that, a support group for men.
Yeah, I don't know what your thoughts are, Tony, but I certainly feel that sometimes it's taboo. It's also the potential embarrassment of saying how I feel around women I don't really know or particularly like. But if it was a group of us men, a brotherhood, if you will, then men might open up.
And maybe there's a big demand for it. I don't think anyone's tested that I can know of or think of. So maybe that's a brilliant idea. And I'll begin to ask a few of the guy patients and see what kind of take-up there is in it. It's a very nice idea.
Conversation we're having with Mandy and Tony Rodrigues around fertility. When we come back, we take a look at stress during times of COVID. Stay with us. Thank you for staying with Cope in the house. Power couple Tony and Mandy Rodrigues, and we're discussing all things stressful. It's been a huge amount of stress that people have had to deal with during and post this COVID period. Tony, your experience with that, what are the levels of stress? What is bringing on the stress?
So interestingly enough, in the first 2 months of the lockdown, there was no question that the fertility rate, the natural fertility rate in our patients who have fertility problems, and severe, some of them, fell pregnant. So that was very interesting during that time. It was almost like a forced holiday for people. They didn't have a choice. They stayed at home and seemed to love it. There's definitely still a big group of women that are at home and patient-wise that are really enjoying the fact that they're working from home. That pressure's off, and getting up and making sure you dress properly and you're climbing the traffic and collect food on the way home. That pressure's gone. It's a little bit different with the guys. I'm finding that they are taking strain.
Yeah.
So it's been quite an interesting journey from a fertility point of view. Our long-term patients, once we opened up again, and we do have strict controls in our building. We use application for entry. patients track themselves on a symptom-wise every day. So we're trying to limit that. It's actually been pretty good with our old patients. I think Mandy's seen quite a lot of them from a stress point of view. But what I have noticed, it's starting to go downhill now. The patients, the people at home are working long hours. You're starting to see that stress fatigue because of that. So they don't know when to switch off because people abuse each other by creating meetings at the wrong time of the day. So those things will have to be dealt with. But overall, we've been okay. On the male side, there was an interesting factor. We found that there's a thing called sperm binding, which is the ability of the sperm to bind to an egg. So these were all planned in vitro patients. And there's been suddenly a lot of these men with poor binding. We would have been doing in vitro, but we have to do an extra technique now. So I think there is much more underlying stress amongst the couples than they're letting on. But we've gone pretty much through it, and our pregnancy rate is the same. Obviously, during the time we didn't have international patients, and it's quite a big group. And our new patients, people were scared to go to hospitals. But that's from a clinical point of view. I think Mandy has seen a lot of stress actually at a different level.
Mandy, your experience of the last few months?
So yeah, I think 2019 was a bad year for a lot of people, and we all anticipated this would be a better year. Initially, there was this huge shock because here's this trauma that the entire world is exposed to. Usually we watch it on TV. Initially, I think a lot of shock and disbelief, and people kind of went with that hard lockdown, didn't anticipate it was going to carry on indefinitely, and that's the problem now. It's still carrying on. So in terms of fertility, a lot of my patients had to delay, obviously, their treatments. And then when lockdown continued, they weren't sure, how do we social distance? How do we fall pregnant?
Why did they delay?
They delayed because they were worried about coming, obviously, to a hospital. Secondly, they were worried about the financial implication. Huge article by, I think it was the Times magazine, saying that people have now, the US is going to face a big problem that due to COVID, people are halving the number of kids they would have or not having at all due to the financial implications, the uncertainty, and inability to afford this right now. Also worried about if they get COVID during this time and they're pregnant, what are the implications? So that was initially. Now people are getting a bit more secure about coming back, especially because certain clinics use applications and are very, very well monitored. They don't know when this is going to end. And then challenges working from home as well, because a lot of them are having to return to home now or return in the new year. But it's not the same. So the ones who even gave birth or who are celebrating a pregnancy could not have baby showers, could not have baby reveals, gender reveals. They delivered.
That's a big part of being pregnant, isn't it?
Absolutely, is enjoying all of those milestones. And especially the moms who lost babies. That was the toughest. I go cold when I think about it, that some moms had stillbirths, they lost babies in the hospital, and their husbands or significant others could not be with them. I had to be at a delivery of certain babies because you couldn't have anyone there. And even when you have a healthy baby, no one can come visit you. So very different. And the little babies are what they're used to is a little mask. So I've got some little babies presenting with huge separation anxiety, which we didn't see.
How does separation anxiety manifest?
So it's manifesting that they won't go to even a nanny or a child carer. They won't even go maybe to their fathers. They're very marfas and clingy to their moms, and more so than we've ever anticipated, because they don't go to baby groups. When they're seeing faces, they've got masks. When they're watching TV, there's masks. Wow. That's the norm. They're sanitizing. You get little toddlers who know how to sanitize. They're just learning to walk. Their little boots get left outside. So huge separation anxiety issues that I think is going to present with delays maybe in the future.
Tony, you talked a little bit about an app, and I know that you're involved in that area, some incredible stuff that you've been able to do.
Yes, so when, I'm involved in a company called HealthLogs. It's a medical application that we've been working on. I've been with them for a year. And when COVID popped up, I said, look, we've got to add a COVID experience to it. And during that early lockdown, I designed the initial architecture of it, and then it was put together by the rest of the team. And by around 2 months, we'd actually developed the product and extended it now. So the beauty of that is it reminds people, because on a daily basis, you can symptom track. You go online, it's a free application, so anyone can go and download it. And if I track myself every day, one, because I think it's good for me. It reminds me that there is this disease out there. It reminds me that I'm well. And we use it for people to get into our building. So it's an easy access app. You come in, there's a QR code, it's QR coded, and the questions are there, and you click and go. So it's very quick, temperature taken, and then it reads back to our whole system. I have a full read back of who came into the building, are they fine? There's contact tracing, and we have an ability to...
Are people honest, though, with those responses?
Yes, I think honesty's... Most people are honest in this world, I think there's going to be one or two dishonest people. Obviously, the temperature taking is a barrier to entry. So immediately it gives you a thought process if you're going to go to a place and you're going to put there, I don't have symptoms. I find people are actually honest. They tell you they've got symptoms, And it's been used, for example, in the PGA at the moment. These tournaments, that's HealthDocs has been used. The guys have to track themselves, and they have to show at least a 10-day window that they're symptom-free. And if they don't, then they're going to get retested and retested. And they've used it on all the golf tournaments, and there's been no problems whatsoever, actually. Not in terms of people becoming COVID positive, they have, but immediately it's mentioned, their contacts are traced, they are moved out of it. So it works, and I think it's a nice application, just for free, to go and say, we got to remember we're in a pandemic. And it actually gives you that security that I'm actually fine. Because the symptoms tell you when you're not fine. When you're really feeling sick, you'll know, because it'll pick up on the symptoms. So I think it's a great app, not because of we designed it, but because of how we've seen it being applied.
Mandy, I'm just going to go back, and I hope, Tony, you can chip in here. We've obviously talked about support groups and how support groups are predominantly women-driven. Men obviously don't like to come out there and hi, I'm Hugo and I'm stressed type thing. What about an app that supports men that are stressed or that have some form of anxiety, that would like to speak to the next guy who's in a similar position without identifying myself? I could just be a random 65, but you know what, doc, I've got this problem, how do I deal with it?
So in terms of an app, I think they have tried with certain apps, again, targeted at females. I feel the face-to-face contact and the coming in a group is more facilitative. Would an app work? Possibly so.
But here's the thing, Mandy. We are dealing with individuals that don't like face-to-face, right? That don't like to talk about their feelings. So we're saying, how about trying to do a compromise where you don't have to come in? It is COVID times. How about you chat to us about your problems? Because your problems, your refusal, so to speak, to talk about it is impacting many of your patients potentially.
So yes, applications like House of Fertility and, they're more web pages and support groups. They do have the option, I think, of sending anonymous WhatsApps or emails to House of Fertility and getting feedback from them, or where should they go, etc. Again, I guess it's on Instagram and LinkedIn, and so you are pretty visible, but there is a number you can call and speak to them. And again, the support groups, I think, especially like the last support groups, the Hope Box Initiative, it is not going up there and saying, I'm Mandy, I'm an alcoholic, or I'm Mandy, I've lost a baby. It's not that at all. It's expression through art. So a lot of the patients come, or the couples, they bring their mother-in-laws, and they don't talk one thing about their loss unless they want to. And they're busy building hope boxes for other moms.
So it's you redirecting this negative energy, if you were.
That's it, into moms who are potentially losing babies next month and the month after. Nobody needs to talk, but you find that they talk. You're there for coffee, you're there for snacks, you're doing something with art. That works.
Yeah, I think there is a place at a different level for information for guys. You know, Health Docs is much more complicated than COVID. It's got a whole full application for metrics, for doing your blood pressure, diabetes checks, documentation, sharing of documents with doctors. It's very, very complicated, but within that complicatedness, it's driven by the person that owns it. So I've got my app and everything about me is on there if I move around to anywhere. So yes, there could be sharing there. We are looking at that. We are looking, interestingly, and you'll find this interesting, that we just read an article that when they looked at the Oracle employees, 85% of them suggested that they would be happy with a robot giving them feedback on if they were depressed. And so you can begin, I can take Mandy and use her intelligence and then package it through machine learning and actually allow a robot to answer those questions that give you immediate acute management.
Would that be because people do not want to speak to another human being that they know about their problems?
Correct. That's exactly it.
Yes.
But it's giving
and
you
it's
the messages.
immediate feedback.
And it's immediate, and yes,
So
and it packages you. It's like our course that we do, the TUPS course. In our initial assessment, there is a depression measure, and one of Mandy's patients, or our common patient, did it like 2 weeks ago, and it popped up on an email. You're showing high signs of depression. Please contact a health professional. So there was an immediate thing. As soon as she filled it in, 5 minutes later, there's an immediate response. It gives that person, I have got a problem. I don't need to be embarrassed about this problem. So I think technology together with humanness, you need both. That's my feeling on it.
Absolutely amazing. We could have talked on for a few more hours, but that's all the time we had. Dr. Tony, Mandy Rodrigues, thank you so much for coming on to Cope.
thank you very much,
Great being
Hugo.
with you.
Thank you.
Thanks for being with us. We're back again next week for another exciting edition of Cope. Goodbye.